Good morning, colleagues. I hope everyone is doing well and in good health. Thank you very much for your time and interest toward our session. And before starting, let me share some technical information. So in the end of the session, we will have discussion and our speakers would be happy to answer your questions. So please don't hesitate and send us questions or send me questions directly. During 45 minutes, our speakers from Eastern Europe and Central Asia will share information about community-led monitoring, mobile application Oneİmpact. The adaptation process of Oneİmpact to country context has been finalized, and the tool is currently rolled out in Azerbaijan, Belarus, Kyrgyzstan, Ukraine, and I would like to mention that Ukraine started implementation process earlier with support of Stop TB partnership. Kazakhstan started adaptation process of the digital tool in August 2020, and we also have very interesting experience from Tajikistan, which will be shared today in terms of importance of sustainability and continuity of community monitoring model driven by community. Our speakers will present very interesting experience, which is at the same time is different from country to country, with success stories and challenges as well. And before I'll give floor to presenters, I would like to highlight that COVID-19 times creates a lot of challenges for TB community, but there are some opportunities as well. And I assume that innovative mechanisms led by community become very actual and important, because it's very good possibility to reduce barriers faced by TB patients, provide real-time case-by-case support, and generate data for NPP and local authorities to inform systemic changes.
Тем самым способствовать системным изменениям. И,
конечно же, COVID-19 times, when health systems are struggling with emergency situation, using innovative mechanisms and unite efforts of civil society, community, and other stakeholders, including the service providers, are crucial and makes our work. So I think very interesting session will be today, I hope so. And I'll give floor to our first presenter, Svetlana Nikolaevska from Center, which will share a presentation about supporting community-led monitoring in Eastern Europe and Central Asia region, implemented in framework of the Overall project.
Thank you very much, Marie. It's a great pleasure to join this session. Can we move to the next slide? So in the next 5 minutes, I will shortly address the following 3 questions. What is community-led monitoring of the TB response? What TB Rep does supporting community-led monitoring? And what are the some lessons learned? Next, please. So, just to make sure... Next, please. Just to make sure that we are all on the same page on what community-led monitoring constitutes, here are some key elements of the definition of this approach, which refers by efforts by communities to collect and use information to improve quality of health services. So the distinct elements of the community-led monitoring is that it's not only about generating the knowledge, but it is focused on stimulating positive and corrective action. In order to correspond to this goal, the community-led monitoring mechanism has to follow several principles. And in the context of our today's discussion, I would highlight 3 of them. Namely, it has to be community-led, allowing communities themselves design, implement, and carry out activities. As well, it implies active stakeholder engagement, ensuring that stakeholders consider feedback and findings generated by community-led monitoring, and it has to be action-oriented and transformational, meaning that the focus is on getting information that will translate into action and change. Next slide, please. So today's session is about sharing the experience of the TBREP project in supporting the community-led monitoring in the region. TBREP project is a multi-country initiative implementing in 11 countries from the region, and it actively promotes the people-centered model of TB care. We do so through health system strengthening and community system strengthening, and community-led monitoring is one of the aspects of the overall community engagement spectrum. So when applying the people-centered approach, one of the gaps existing in the region is that TB patients and communities do not have a strong voice in monitoring quality of care and access to systematic means to report on quality of care issues in order to ensure provider continuity and demand quality services. Addressing this gap, project is supporting the implementation of the digital solution for community-led monitoring, namely Oneİmpact, the mobile application developed by the SOP3 partnership. And in line with the previously mentioned principles, this approach is driven by TB-affected community and guided by the NTP. Next, and you can see on the map the countries that are currently supported by TBREP in implementation
те страны, которые
of
сейчас выполняют
Next
этот
slide,
проект. Следующий слайд.
So how is monitoring done through this
Как проводится
Oneİmpact approach? The platform consists of 3 parts.
При помощи приложения
People affected by TB use the mobile application to notify community, but also formal health system about the gaps in availability, accessibility, or quality of services. The important element embedded or included in this system is the integrated feedback loop mechanism, allowing for rapid response from community, but also from national TB programs to address those reported barriers. I also would like to highlight that this monitoring has to be productive, collaborative, but also solution-oriented, meaning that it has to be associated follow-up
проводится в
process
сотрудничестве,
and
также ориентирован на выявление решений.
health actions. Next slide, please. When we look on what type of data countries are monitoring, here we have the 4 essential elements of the care delivery, namely availability, accessibility, acceptability, and quality. And the focus for all those elements is on human rights barriers faced by people affected by TB. We have to mention that this data collection has to be systematic and routine. One-off assessment are not sufficient, so it needs to follow up and continuous improvement. Next slide, please. So what are some lessons from TBREP on supporting implementation of this community-led monitoring approach in TBREP countries? So we see that there is increased interest in community-led monitoring in regions, and the tendency to view communities as credible partners, not just as beneficiaries. The community-led monitoring system leads to coalition building among civil society groups. The digital solutions are useful for community-led monitoring
общества и большего сотрудничеству с
finally, the closing the loop of a feedback loop is one of the most critical aspects, and this implies
один из наиболее важных аспектов.
Next slide. I would like to conclude addressing our acknowledgement to the partners and to our institutions that we cooperate with in implementing this, namely TV People, Top TV Partnership, and Direct Technology. And you can always address us for more information, but we will share more in next presentation.
Больше информации, написав мне по email.
Thank you very much, Svetlana, for the impressive presentation. Our next presenter, Abdusamad Latif, and Abdusamad is a co-founder of a national multi-stakeholder coalition for TV Partnership Tajikistan, which unites and advocates for people by TV. Currently, Abdusamad is working as a project coordinator to lead the activities on UNİON. And Abdusamad will share information and experience from Tajikistan about the importance of community-led monitoring during COVID times to ensure the continuity of TV services.
Эпидемии COVID для того, чтобы обеспечить
Thank you, Maureen. Yes, thank you very much, Maureen. And I would like to also thank the organizers of this session. This very important session to give the opportunity for the community to present the importance of community-led monitoring, especially at times of COVID. Next slide, please. So, so as we all know that there are lots of pandemic-related challenges these days. People are at home in isolation, and they are detached from health facilities. Like in Tajikistan, like people with DRTB are provided with medicines for 1 month, and people with susceptible TB for 2 months. And currently, there is a zero delay in connection of TB centers with people. And apart from that, I mean, workload and insufficient of healthcare workers, I mean, people with TB or their family members have to visit the TB centers to collect their medicines with insufficient protection measures. And apart from that, there is another more like 2 major related issues that has historically been there, like human rights data gaps and also engagement gaps. So in times of COVID, in Tajikistan in March 18, so we had an emergency meeting at the national level with participation of all the stakeholders and partners, including CCM, NTP, international organizations, local organizations, affected community, and so on. So we developed a national TB program called COVID-19 Third Response Operational Plan. So in this operational plan, so each partner has been given the specific role on what they can do. So since Top TB Partnership has been had a very good experience in using digital solution Oneİmpact. So in 2017, Stop TB Partnership Tajikistan with engagement of NTP for the first time piloted Oneİmpact in Tajikistan, and so there was a great experience on that and good results. So due to lack of finance and due to lack of finance and change of priorities, so this experience has been put aside for quite some time. And then at times of COVID, so again, the NTP saw the necessity of this Oneİmpact to be implemented in the country. So in this operational plan, the Stop TB Partnership has been given tasked to upgrade the Oneİmpact with COVID-19 information, HIV, and also information on hepatitis. Next slide, please. Yeah, so then with the financial support of Stop TB Partnership and also under TB RAP projects and technical support from Duke Technology, we have upgraded the Oneİmpact in Tajikistan with inclusion of COVID-19 information and also information on TB and HIV and hepatitis. So this experience now this Oneİmpact is being implemented in one of the most one of the largest region in Tajikistan, in Khatlon region. As you can see in the map, so Tajikistan is 93% of Tajikistan is mountainous and only like 7% is flat. So in this Khatlon region in the south part, we started the implementation most recently with the most updated and upgraded Oneİmpact Tajikistan, which contains information on COVID and other necessary information that at times of COVID is needed. So in terms of sustainability, I would say that we managed to include Oneİmpact to ensure sustainability in three important strategic plans. So we included Oneİmpact implementation of Oneİmpact in the country scale in National TB Strategic Plan for 2021 and 25. And apart from that, we have been successful to include it in the transition plan, country transition plan, from donors funding to domestic funding. And in the most recently country funding request to the Global Fund, we also were successful to include the Oneİmpact with with the engagement of NTP to include it in the request to the Global Fund. To this request goes in the main application just to scale it up in the country. And apart from this, Oneİmpact is now also being interested with newly opened USAID funded project EECA, so they also plan to implement it in their projects, pilot projects. And apart from that, under USAID loan project, we're also planning to implement it in other regions, which is not people that doesn't have access to this platform. So in the next slide, please. So as you can see here, so this is the basic features as colleague Svetlana already mentioned. So it has got these features like get knowledgeable, get access, get connected, and get involved. Next slide, please. So here we have accountability framework, and actually it works like people affected community or affected people affected with TB, they report their challenges, and then we have the response team that will discuss and reply to them, and then we have a dashboard where we collect the real data to feed our advocacy to advocate for those challenges at the national level that you can see in the right side. So in the next slide, please. So this is the lessons that we learned. So I won't go too much to those. So this is the general lessons that we learned. So this will help us to organize, the feedbacks and those data that we collect in this dashboard of Oneİmpact that can help us to organize national multi-stakeholder dialogue on human rights and other issues that we have. So currently now we are also under TB RAP, we are also organizing the national dialogue where we also will bring some important data that we collect directly from the patient in that level. So this is it, and if there's any question related to Oneİmpact Tajikistan, I would be happy to answer. Thank you.
Thank you, Abdusamat. Very informative, and thank you for sharing not only information not only about challenges but about opportunities as well. So let me introduce our next presenter. It's Natalia from Belarus. Natalia is chairman of the board Republican Public Association Defeat Tuberculosis Together. And Natalia Kristoforovich, also Project Manager of Mobile Tuberculosis Navigator, project implemented within TB Rep 2.0. And Natalia will share experience from Belarus. Natalia, пожалуйста.
Она поделится своим опытом из Беларуси.
Спасибо, Мария, за представление. Действительно, в Беларуси внедряют проект Республиканское общественное объединение «Победим туберкулез вместе». Это организация сообщества людей, затронутых туберкулезом. И что хочу рассказать о том, что уже было сделано в рамках проекта ТБРЭП-2. Это приложение адаптировано для Беларуси. Мы изменили структуру подачи и содержания информации в мобильном приложении. Провели фокус-группы с представителями сообществ, пострадавших от туберкулеза. Доработали чат, доработали модуль обратной связи и модуль напоминаний, а также собрали информацию для внесения в Google карту по приложению. Также мы начали проводить тренинги на уровне сообщества, но случился ковид, и пришлось переформатировать всю работу по обучению сообщества и медицинских работников, а также обучить команду проекта работе в сети. И в дальнейшем мы предполагаем работать очень частично, возможно, в полях, но основная работа будет в сети. Значит, мы привлекли также консорциум общественных организаций, затронутых проблемой туберкулеза и ВИЧ к работе в группе реагирования на барьеры, мы сообщаемые через мобильное приложение. Oneİmpact Беларусь это называется у нас. И мы, скажем так, это для консорциума, это первый проект, в котором организации работают совместно. И мы планируем продолжить это на другие какие-то проблемы. Какие вызовы стали перед нами? Мы прошли сложную длительную процедуру регистрации проекта через Министерство экономики Республики Беларусь. Для чего это надо? Потому что передача приложения в проектной документации не было предусмотрено, и сейчас мы опять же находимся в коммуникации с Министерством экономики для того, чтобы включить это передаваемое приложение в оборотные, скажем, средства по проекту для освобождения проекта международной технической помощи от налогов. Значит, для чего это опять же надо? Для того, чтобы это приложение было в правовом поле в нашей стране, в Республике Беларусь, для возможности дальнейшей передачи программного продукта Министерству здравоохранения или другой государственной структуре. В настоящее время идет процесс физической и юридической передачи мобильного приложения РРО «Победим туберкулез вместе» от Центра ПАС, чтобы выполнить требования законодательства о физическом размещении баз данных на территории Республики Беларусь. Это требование обязательное. Сообщество не имеет опыта такого участия в этих процессах, и поэтому это идет довольно медленными темпами. Значит, что мы еще сделали? Доработали форму регистрации пользователей с использованием СМС-подтверждения регистрации. Это тоже обязательное условие. Это также обязательное условие использования приложения. Какие выученные уроки? Это...
What are the lessons learned?
Продолжайте, Наталья.
Let's carry on, please.
Да, какие выученные уроки? Это...
What are the lessons learned to date?
Это внедрение мобильного приложения не принадлежит одной организации. Необходимо создавать механизмы координации и совместного планирования мониторинговых мероприятий на уровне сообществ с использованием настроенного приложения Oneİmpact Беларусь и привлекать организации из других сообществ. Сегодня в консорциуме, который работает в группе реагирования проекта, входят 4 организации и сообщества, а также 4 партнерские организации. Это ВИЧ-сервисные, как правило, организации. Также успех проекта зависит от того, насколько широко мобильное приложение известно пользователям. И изначально было недостаточно продумана рекламная кампания, это не в достаточном объеме, так как рекламная кампания продумывалась в проведении мероприятий, мини-тренингов, а сейчас мы переходим на работу через сеть интернет, и требуются другие, скажем так, активности. Также, что мы сейчас делаем, это работаем над устойчивостью финансирования деятельности по проекту, то есть устойчивостью мониторинга усилиями сообществ. Что было нами сделано? Мы внесли в предложение в национальный стратегический план, чтобы это направление обязательно было в стратегическом плане. Также выученный урок для меня, что почему-то недостаточно портфолио-менеджеры, глобальный фонд информированы о том, что в странах не хватает подобных инструментов, как Oneİmpact, для сбора информации, например, о катастрофических финансовых последствиях для людей. Это оказалось единственным таким в стране инструментом, но пока почему-то это не рассматривается как действительно заслуживающий внимания.
Спасибо, Наталья, очень интересно. And I give floor to our next presenter.
Я хочу передать слово нашему следующему докладчику.
Елена Жирнова from IQ Kyrgyzstan. Елена is a project manager of community against tuberculosis.
Елена является менеджером проекта, который выполняется по поддержке TB-REP-2, и она поделится с нами опытом из Кыргызстана. И извините за технические моменты. Елена, пожалуйста, вам слово.
Dear participants, I'm very glad.
Уважаемые участники, я очень рада представить вам опыт Кыргызстана по внедрению мониторинга со стороны сообщества.
Mobile application.
И мы внедряли мобильное приложение Oneİmpact.
In pilot area Churi region.
И пилотной областью была Чури.
These two areas have the number of TB cases among other.
Так как там наибольшее количество случаев TB.
Stage we updated the application.
Мы также обновили это приложение.
And of course community representatives.
И, конечно же, этим занимались и представители сообществ
developed by Stop TB Oneİmpact application.
От контекста страны.
A series of consultations with TB.
Мы провели серию консультаций
to find out their expectations from the application and their most common barriers they face.
Мы провели консультации с сообществом, которые касались наиболее общих барьеров. Да, но я ее не слышу.
Next slide, please. It's, the final version of Oneİmpact.
Финальная версия Oneİmpact
was ready to be launched in Kyrgyzstan this year. And of course,
была в Кыргызстане в этом году зарегистрирована.
In terms of COVID-19.
И, к сожалению, из-за ситуации с COVID-19 была задержка некоторая.
Provided based on TB facilities, And it means that
мы предоставляли это на базе учреждений противотуберкулезных.
But public TB service, like
общественные противотуберкулезные службы,
most of them are at retirement age, and moreover, now TB facilities were
они не были вовлечены в это, и были учреждения, которые занимались лечением больных с COVID.
Most of the patients went to outpatient care.
И многие наши пациенты перешли на амбулаторное лечение.
Included cancellation of public events, restriction of
gathering. Также были отменены различные публичные мероприятия и общественные собрания.
In place of the initially planned trainings for TB patients, we have to individual
изначально запланированных
how to download,
тренингов мы проводили индивидуальные консультирования,
doctors and responded team,
проводили консультирование с фтизиатрами и пациентами.
The application became
и также старались воздействовать на приверженность к лечению.
To get reliable information,
с помощью этого приложения мы можем получать достоверную информацию.
So due to four key components of the application, the patients now have an access to the information. They
Сейчас благодаря этому приложению у пациентов есть доступ к информации. Также мы можем собирать различные данные. Они включаются, находятся на связи.
Of course, they can raise various issues.
И они могут обсуждать различные проблемы.
After more than 2 months of the promotional activities, we have 200, more than 250.
После внедрения этого приложения у нас уже более 200 подписчиков, 200 пользователей.
Most of those cases are related to effects. And among other reported cases,
случаи барьеров, о которых сообщают, они касаются побочных эффектов.
And for now, more than 50% of the reported cases
более 50%
by our specialists of the responder team
уже были разрешены нашими специалистами.
Cases which are
оперативной бригадой.
Because we need sometimes more information.
Потому что иногда нам нужно больше информации.
For consultation. And
для того, чтобы провести правильное консультирование.
Test cases because sometimes patient report cases just to verify
иногда
the application is functioning well.
Нам пациенты сообщают о каких-то барьерах
from the responder team because the application is quite new tool for our country.
Лишь чтобы проверить, как работает приложение.
Елена?
The important part of the project.
The time. Елена, time.
Yeah, okay, just.
Время.
Ирина, можете не перевести, пожалуйста?
Хорошо.
We have an issue with the translation, so better do not translate.
Okay. 1 minute. On the information that we get through the Get Involved section is collected in the dashboard panel, as I said before, we work in close cooperation with NTP, which has oversight function of TB facilities, and one NTP representative is engaged in our activities, and she always records the feedback that we receive during training consultations. And after all, we will provide the quarterly reports to NTP about cases and feedback that we have from the patients, with the main goal to increase the quality of services, to make the patient's voices heard, and to be taken into account in decision-making process. So this is a brief information about the project in Kyrgyzstan. Thank you for your
Thank you, Elena. And I would like to present our next presenter, a speaker from Azerbaijan, Parvana Valiyeva. Parvana is an executive director of Saglamigla Hidmet Public Association and project coordinator of improving and advancing people-centered healthcare through adjusting and implementing Oneİmpact tool to the country-level project. So Parvana, please share your information and experience from Azerbaijan.
Thank you very much, Maria. I am very happy to be a part of UNION conference this year. I am going to present you how CLM tool strengthened cooperation between NTP and other governmental organizations in Azerbaijan. Real-time feedback from people affected by TB helps at immediate support to the people. We collect information directly coming from TB patients in providing, taking corrective measures in provision of TB care by NTP and or other local service providers. And CLM avail us together qualitative to generate qualitative and quantitative information that we can use it to assess availability, accessibility, and quality of TB services. And also we use this information to hold service providers and decision makers to the account. We refer, thanks to our CLM tool, which information which refers to evidence-based data. Our CLM tool was adjusted as Oneİmpact Azerbaijan within TB-Rep2 grant last year, and we present it to the public this year. The tool addresses gender-based stigma in Azerbaijan, that 85% of the reported cases coming from female users who are more stigmatized, hide often their sickness, and now can confidently report their problems via CLM. We have now more than 600 users on the system, and more than 100 cases reported via CLM, the challenges the patients face. And the presentation of our CLM tool was happened by chance during the pandemic. Therefore, it was a very good example to other healthcare providers in continuation of health services, other health services in Azerbaijan, in our country. We promote with our Oneİmpact application digitalization of health services in Azerbaijan, and the app was highly appreciated by the Ministry of Health, mandatory health insurance body of Tabib. Before CLM, I would say that we had limited number of beneficiaries. They were mainly ex-prisoners and prisoner TB patients, but this tool scaled up the area we work and the number of beneficiaries 10 times. We receive different parts of our country, the challenges they reported, the problems reported by the patients via CLM. Also, CLM output strengthened the collaboration with national stakeholders. It created a demand for us to build new partnership, cordial and mutually beneficial cooperation with our organization and between our organization and other healthcare facilities, medical officers, and relevant ministries. As a result, it also strengthened multi-sectoral approach in TB response in Azerbaijan. National monitoring and evaluation system managers actively involved in development of program indicators and overall in project implementation. NTP curators, each of them responsible for 4 or 5 regions of our country, also involved in response team to investigate the challenges reported by the patient and also promotion of the CLM tool among TB patients. Community reports also prepared our organization and submitted to the NTP quarterly, and our CLM tool is planned to be handed over to NTP for maintaining its sustainability. The mostly challenges reported by the patients was on getting access to state social protection services, and therefore we hold some meetings with Ministry of Labor and Social Protection of Azerbaijan. As a result of these meetings, the following agreed to launch a working group with the ministry officials to discuss semi-annual problems of TB patients reported via CLM, also involve ministry representatives in online discussions to discuss social problems, and the application, the requests addressed from our organization to ministry validated fairly, investigated more attentively, and accepted trustful, because we have, as CSO, we have an objective and transparent system that generates data coming from directly from TB patients, and as a result, our CSO acknowledged as a reliable and competent partner of the ministry. I would like to give an example. A few days ago, a female patient who reported her problem via CLM get 5 years of monthly social allowance by the Ministry of Social Protection, and after we apply them to protect her rights. And this is our success, first success of Oneİmpact Azerbaijan, thanks to our all facilitators of this application. As a result, the patients are provided, will be provided with people-centered social services. Thank you very much.
Thank you, Parvana. And our last speakers for today's session with very exciting experience from Ukraine is Olga Klimenko and Vitalina Ustenka. I'll give you floor directly because we have very limited time. So
yeah, we see.
Please.
Okay, thank you very much. Please, next slide. There is some statistic matters. As you see, every third applicant give us some case, every third person who registered. And in all, we have 51% of female, 49% of male, and 1% of transgender patients in our application. I would like to separately focus on the role of community because our work with social and medical workers and successful problem solving give us more number of cases every month, and there is a positive dynamic in appeals. For example, in half of 2020 year, we received twice as many requests and all 2019. And here is some analysis of barrier reports. Next slide, please. You see that the most barriers come to the sector other. There are appeals that require consultation with lawyer or psychologist or material assistance, and material assistance is the mainly questions which is reported in our application, and we have some ways how to help people with these problems. Next slide, please. There is information about why patients stop treatment, and we think that it is the most, the main, our aim to help them not stop in treatment and do their medicine as they did. So we, no, please, previous. Two words. For each of this problem, we propose them different kind of help. It could be medical service, it could be product certificates, transportational costs, free legal assistance or free psychological consultation, and many of them we refer to other NGOs and we work together, and we think that we help people not stopping the treatment. And now I'll show you algorithm of case solutions that we developed in Ukraine. Patient or social worker now during the COVID, there are many social workers or medical professionals who gave the applications. Then we accept the request and contact the user, know some information about the treatment, but all the information is located in the supporting hospitals of the region, and they receive the treatment regimen to the public health center of the Ministry of Health of Ukraine. And we must verify some appeals to help people. When we have an application, a verification, we began to salute them, and we could do it ourselves with regional representatives of TB People Ukraine, or with our partner organizations, social workers, or public health center. And the last slide, please. We think our big work all over the country consists of that we made a work of multi-sectoral group with different professionals in different government and non-government organizations. And there are some main functions. It's monitoring applications received through the Oneİmpact, and within its competence, we could provide recommendations and proposals for changes in law all over the country, and some national new national documents or government politics in the TB. And we provide organizational and methodological advisory assistance to NGOs or other regions or oblasts or cities counseling about implementation and monitoring widespread from abroad documents and how to implement them in Ukraine. I tried to be short. Maybe
Thank you
Ola,
very much, and thank you very much to all colleagues for sharing this, very helpful and useful information from the region. And we, as you can see, we don't have time for questions, but I received only 2 questions, and regarding complications posed by COVID and sustainability, which I guess were covered by our presenters. So sorry for this, and I want to, maybe make some conclusions and underline some important topics which were discussed today. First of all, it's about empowerment of TB community, which is key component of the community-led monitoring intervention and very important component. Also, only by combining efforts ensure multi-sectoral and inter-sectional work will be possible to end TB in times of COVID. The Oneİmpact model is flexible and can be adapted to meet local needs such as language, data storage, etc. And the success of the community-led monitoring model depends on how widely the mobile application is known to users. So Network TB People is developing community engagement strategy, which will include advertising and popularization components, and we will happy to share it with you. And in the end, I want to thank you all speakers, translator, my co-chair, Christina Chelan from PASS Center, who helped me with timing, and of course, Top TB Partnership colleagues and Duo Technology as our partners, and all of you for participation. Thank you very much, and stay healthy and safe.